have been studying the Hispanic Community Health Study, which is a large population-based observational study that's been ongoing now since 2008, and we have been following them for since that time. And most recently, we have observed different associations with sleep apnea, for example, and how it associates with different cardiometabolic disorders such as high blood pressure and diabetes, and incident hypertension and incidence of diabetes, new diagnosis of hypertension and diabetes. Most recently, what we did is we understand that sleep apnea, the way that is diagnosed, we actually diagnosed it with a sleep study. And we have this metric that is called the apnea-hypopnea index, which is really, this index is really a composite of different things happening at the same time. And we use that in a very always, meaning we, the sleep specialists, in a very homogeneous way, because it works clinically, but when we have tried to see how it helps, how it predicts different outcomes, such as cognitive problems or cardiovascular disease in large trials, it doesn't pan out. So we have come to recognize that sleep apnea is probably more of a heterogeneous disorder now over time. And one of the recent efforts that we have done in the Hispanic Community Health Study is that we did cluster analysis where we are able to use certain statistical techniques, and with those we're able then to define very specific groups that do not overlap and see how the sleep apnea patients or participants are in our study. And we observed 3 different groups. We saw people that do not have any symptoms at all, at least do not endorse them. And then we have a group that only had insomnia symptoms, or mainly insomnia symptoms. And those were about 40% of the group, and about a third of them had daytime sleepiness, and they did not overlap at all. So those 3 groups, all of them had sleep apnea based on their sleep study, and the different cutoffs that we use to define sleep apnea based on the sleep study. But in terms of the symptoms, again, some of them only had insomnia, some of them only had daytime sleepiness, and a lot of them did not have any symptoms at all. And what we did see is that those that actually did not have any symptoms still had an elevated risk of having high blood pressure, an elevated risk of having diabetes, even if they don't have any symptoms. And that's important to know, because usually the people that have symptoms are the ones that go to clinic. So it prompts us to try to, in follow-up studies now, try to see how we can actually try to improve our catchment of people that may be at risk for sleep apnea, more so in Hispanics and other minorities that are at higher risk for having high blood pressure, diabetes, and all these other issues. We also observed that again, there's a lot of people with insomnia that also have sleep apnea as kind of the main symptom. What happens is that those people also usually don't go, or at least usually are not referred for sleep studies. And they tend to be usually women. So there might be a large part of the population that we are not diagnosing with sleep apnea, are not treated properly because they don't fit the classic, the classic criteria for sleep apnea that we usually are accustomed to, which is usually the middle-aged, little bit obese male that tends to be, a large snorer with obesity. So we see that using these techniques, we were not the first to do so. They have other groups that have done so. We are able to see that within Hispanics, there are these different clusters is telling us that there are other clinical scenarios and groups that will benefit from potentially trying to reach out and making sure that they get treatment for sleep apnea, or at least trying to diagnose them for sleep apnea, because there are equal risk for having hypertension, diabetes, and also so the consequences of sleep apnea, but most likely are less likely, but they are less likely to be treated, diagnosed and treated.